Hi everyone, I'm Dr. Aleksandra Brown. I'm a board certified dermatologist and welcome back to my channel. If you've ever noticed rough bumpy skin on your arms, thighs, or even your face, you might be dealing with Keratosis Pilaris or KP. This is also known as chicken skin or strawberry skin. This is completely harmless but really stubborn skin condition, and today I will be sharing what causes it, how to treat it, and the best dermatologist approved skincare for KP. If you find this video helpful, don't forget to like and subscribe for more dermatologist-backed skincare advice. Let's get started. Keratosis pilaris is a common but harmless skin condition. It causes rough, tiny bumps that often appear on the upper arms, on the thighs, buttocks, and sometimes even on the face. The bumps are often just skin colored, but sometimes they can be red or brown. Depending on your skin tone, they can feel really dry, almost like sandpaper, giving it really rough, uneven texture. KP occurs when keratin and protein that protects the skin builds up and clogs those hair follicles, preventing the dead skin cells from shedding properly. This leads to these tiny raised bumps that look like small pimples, almost like goosebumps. While they're not harmful or contagious, KP can be really persistent and really honestly annoying. So what causes it? Most of the time, it's really caused by genetics and skin barrier dysfunction. While the exact cause isn't fully understood, certain factors do make it worse. One, genetics. If your parents had it, odds are you're probably gonna get it. Dry skin. KP tends to worsen in the winter or in drier climates. Those with conditions like eczema or atopic dermatitis are also more likely to demonstrate keratosis pilaris on exam. Hormonal changes can also cause fluctuations in KP, such as during puberty, pregnancy, or menopause. And there's some research suggesting that low vitamin A levels may contribute to excessive keratin buildup, therefore making KP more pronounced. In clinic, I often find keratosis pilaris in patients with asthma, eczema, allergies. These tend to kind of run together in families, so odds are if you have one, you might have some of the other ones. So when we talk about treatment, it's important to know that there's really no permanent cure for KP, but the right skincare routine can really smooth the skin and reduce the bumps and sometimes even minimize some of the redness. The key is consistency in your exfoliation, hydration, and barrier repair. So when treating KP, it's all about gently removing the keratin buildup while maintaining that strong barrier. You want to exfoliate to dissolve those keratin plugs and moisturize to prevent dryness and irritation, and also make sure you're focusing on strengthening the barrier to reduce any inflammation. Because KP occurs when keratin blocks those hair follicles, chemical exfoliants like AHAs, BHAs, and even urea are going to help dissolve dead skin cells and unclog those follicles. Many people think that using scrubs like loofahs and things like that will get rid of KP, but this often can make things worse because all you're doing, you're just rubbing them off. You're not really melting away those keratin follicles that have clogged the pores. So scrubs will remove surface dead skin, but they don't get deep into the hair follicle at all. Chemical exfoliants, however, will dissolve the keratin buildup, preventing clogged pores before they even form. So instead of harsh physical scrubs and exfoliation, chemical exfoliants with AHAs, BHAs, and urea will work really gently and effectively to smooth KP over time. That being said, if you love a good physical exfoliant and you love a good scrub, there's one that I do recommend that combines both chemical and physical exfoliation for a gentle but effective formula. So this is our First Day Beauty KP Bump Eraser Body Scrub with 10% AHA. The key benefits here is if you want the best of both worlds. So if you're looking for a formula that's going to chemically dissolve keratin, but also gently kind of buff out that top of the skin, this is a good one to try. It combines physical and chemical exfoliation to smooth that rough, bumpy skin of KP. It uses glycolic, lactic acid at a combined level of 10% AHA to dissolve the keratin plug, while those fine pumice beads provide gentle physical exfoliation. The key ingredients here are the lactic and glycolic acid, pumice buffing beads, and bisabolol. Now let's move on to the types of chemical exfoliants. Lactic acid is going to be your gentlest one. It's the largest, least likely to penetrate deep, so if you have really sensitive skin, this is a really good place to start. It's the best one for gentle exfoliation. Lactic acid is an alpha hydroxy acid that works by breaking down the bonds between dead skin cells, making it easier for the skin to shed from them naturally. It also hydrates the skin, making it an excellent choice for really dry and sensitive skin. My favorite recommendation in this category is, of course, the Unlactin KP Bumps Be Gone Cream. This has 15% lactic acid AHA. The benefits are that it exfoliates and hydrates at the same time, making it ideal for dry skin that also has KP. The active ingredient is the 15% lactic acid, which will smooth the texture while locking in the moisture, and it works best when you apply it to damp skin right after shower. This is really the case for all moisturizers. You want to apply them to damp skin really within 3 minutes of getting out of the shower. It contains 15% lactic acid or AHA, glycerin, and also petrolatum. The next ingredient to talk about in this chemical exfoliant category is urea. This one's very cool. It's very popular lately. Several brands have come out with their own version of urea. It is best for softening really thick, rough skin. We often recommend higher percentage of just straight up urea for rough feet. But here we're going to talk about really delicate topicals that can be used on your whole body. Urea is a very powerful keratolytic agent, meaning it can soften and break down hardened keratin plugs that cause KP. It also acts as humectant, which means it's going to draw water into the skin for long-lasting hydration. It can be layered over lactic for extra moisture, but if irritation occurs, maybe you can alternate the two. My first recommendation in the urea category is the Eucerin Urea Repair Plus 10% Urea Lotion. It breaks down the keratin buildup while deeply moisturizing. It will soothe irritation, reduce any rough texture, and it works especially well for really severe KP with dry skin and eczema-prone skin. The ingredients are 10% urea, ceramide 3, and natural moisturizing factor, or NMF. The next moisturizer in this category is the Inky List Super Solutions 10%. It exfoliates while locking in the moisture, preventing any dryness. It's really lightweight, it's really good for daily use. It also contains 10% urea and hyaluronic acid. And one of the newer moisturizers in this category, and the one I've been using quite a bit this year, is the La Roche-Posay Lipicare Lotion with the urea. It really works well in locking in hydration to prevent dry, flaky skin. It will strengthen the skin barrier, making it more resistant to irritation. It has a lower percentage of urea compared to the other two products listed above, so it's better for really everyday use, and it moisturizes really nice, goes on super buttery soft. It contains urea, shea butter, glycerin, and niacinamide, as well as the La Roche-Posay Prebiotic Thermal Water. The next ingredient we have to talk about when treating KP is glycolic acid. And this one probably works the fastest because it's the smallest of the AHA, so it'll penetrate deeper. It's a little bit spicier, if you will. So it's something that I don't recommend using if your skin is really sensitive. Maybe start with the lactic. But if you need fast results, glycolic is your girl. It's a smaller molecule than lactic, so when it penetrates deeper, you accomplish faster exfoliation, probably at the expense of some skin irritation, if you want my honest opinion. But I've used glycolic on my whole body and I've done just fine, and my skin is very sensitive. Would not recommend starting with glycolic for children at all. If you have a child with KP, use something with lactic acid. The next product in this category is the Ordinate Glycolic Acid 7% Exfoliating Toner. I have this and I have used it head to toe, literally on just about every body part for different purposes. Here lately, I've been using it for KP and in general to smooth over the skin. And let me tell you, after shower, you take this solution, it's almost like liquidy, and you apply it on your whole skin. And first time I applied, I really wasn't sure how to do it. It ran down my legs, but really the easiest thing to do is just to put it in your palms, rub it in a little bit, and then pat everywhere you want it to go. Let that soak in completely. It takes a couple of minutes. When I've talked about glycolic acid on my social media in the past, you guys say that it's sticky. If you sit down or you try to squat down when it's on your legs are going to be sticking, correct? But if you let it dry and you apply cream on top, like Cetaphil cream is what I've been using, just plain cream, but you could totally use that La Roche-Posay with the urea. Chef's kiss for KP. Glycolic with like urea on top, ooh, doesn't get any better than that. Glycolic acid does excellent job at exfoliating dead skin cells, unclogging hair follicles, smoothing rough texture. It also improves overall skin clarity and helps fade some of the redness from KP over time if you maintain it and use it consistently. It works really well for stubborn KP on the arms, thighs, and buttocks. The key ingredient here, of course, is the glycolic acid, and then Tasmanian pepperberry derivative, ginseng root, and aloe vera. The last individual ingredient we need to talk about when treating KP is the salicylic acid. This is the only beta hydroxy acid. It penetrates a little bit deeper into the pores, dissolves excess keratin and oil buildup. It's particularly effective at clearing blocked hair follicles that contribute to the KP bumps. In this category, I love the CeraVe SA cream for rough and bumpy skin. I do particularly like the cream over the lotion. It does a really good job at exfoliating and hydrating at the same time without irritating the sensitive KP skin. Salicylic acid also helps unclog follicles, reducing bumpy texture. This cream is completely fragrance-free. It's non-irritating, makes it really good for sensitive skin. The key ingredient, of course, is the salicylic acid, but also contains a little bit of lactic acid and, of course, the ceramides. If you don't like the consistency, the thickness, or the jar of the SA cream, this also comes in the SA lotion. It's a more lightweight alternative compared to the SA cream. It's a little bit easier to spread, especially if you're going to use it on large body surface areas like your whole arms and legs. And I personally tend to use lotions more in the summer and then creams more in the winter, but that's a personal preference. And the best dual action treatment is the Skin Fix KP Plus Psoriasis Smoothing Treatment Body Lotion. This formula combines exfoliation, hydration, as well as barrier support, making it a really good choice for those with more persistent KP and compromised skin barrier. It gently exfoliates the smooth, rough, bumpy skin of KP. It will strengthen the skin barrier with ceramides and peptides and reduces any discomfort and irritation associated with KP. It targets multiple concerns at once, including keratin buildup, flaking, and inflammation. The key ingredients in this one are the patent-pending BL3 complex with barrier lipids and peptides, also contains glycolic acid and lactic acid at a combined percentage of 5%, and then a little bit of salicylic acid or BHA at 2%, and also niacinamide. So really nice concoction of all-in-one combined into one amazing product. If your KP is really stubborn and you've used all of these, like you have combined your glycolic and urea on top, you can consider adding topical retinoids for really persistent cases. Retinoids work by exfoliating the top layer of the skin cells, increasing skin cell turnover, and preventing keratin from clogging those follicles. A recommendation in this category can be Paula's Choice Retinol Skin Smoothing Body Treatment. It encourages faster skin renewal, improving rough texture. It will target those stubborn KP areas while also hydrating the skin a little bit. It contains retinol, shea butter, and evening primrose oil. In my experience in clinic, there has really been nothing to add topically besides maybe topical tretinoin when treating the bumps of KP. However, the redness, even though I mentioned some of these products may help improve it, redness can at times be stubborn. I do have several patients who are using pulse-dye laser or V-beam to treat their keratosis pilaris redness, but important thing to note here is this is chronic ongoing condition, so it is not one and done. Even if you decide to do laser treatments to improve the redness, this will be an ongoing maintenance type of treatment. So when talking about KP, yes, it's a stubborn condition, but with the right combination of exfoliation, hydration, and barrier repair, you can certainly smooth your skin over time. If you found these tips helpful, don't forget to like and subscribe. You can also find me on Instagram and TikTok at Dr. Aleksandra Brown. Thanks for watching, you guys. I'll see you next time.